Tailors bunions are bumps on the outside of the foot. So a traditional bunion that we hear a lot more about is on the inside, whereas Tailors bunions are on the outside of the foot. So it's a bony prominence right at the area where the foot meets the little toe, and it can cause irritation with shoes and rubbing, and sometimes just pain from the position of the bump walking on the prominence. So Tailors bunions are typically caused mostly by genetics. They usually run in families. It's an abnormal mechanics of the foot that causes the bunion, and eventually over time the bone starts to shift out toward the outside of the foot, creating the bump, and the little toe starts to push inward toward the other toes, and this can be very painful for people. Typically, the bunion isn't really caused by the tight shoes, but people notice it more when they are in a tight shoe. So one of the conservative treatments for a bunion is basically changing your shoes and wearing something that's wider, or adding pads around the bump to get the pressure off that area. It's very similar to the bunion that we hear about most of the time on the inside of the foot. They're very common. Sometimes they're both found together, sometimes not. They can be treated in a very similar manner surgically. So typically for the Tailors bunion, we do a surgery, which is a bone cut through the bone, and then putting screws in the area to fix the bone in place to achieve the correction. Tailors bunions can be diagnosed easily just by looking at the foot, but an x-ray will provide a lot more detail on what would need to be done as far as surgical correction. So typically when you see your podiatrist, you would come in and have the foot evaluated and also have x-rays at that visit to talk about those surgical options. So Tailors bunions tend to be progressive and get worse over time. So sometimes they may start out asymptomatic for a person, and then as that person ages and the deformity gets a little bit larger, they can start to become bothersome and symptomatic, and that might be the time when patients decide to treat it. Surgery would be an outpatient surgery that you'd have done at one of the hospitals here or the surgery centers here in town. The procedure usually involves taking off the bump on the side of the foot, but also doing a bone cut to shift and correct the deformity fully. So then you would have screws in the foot, and as the bone heals, you would be in a walking boot until the time that healing is achieved on x-ray, usually around 6 to 8 weeks for most patients. And then you're getting back into your normal shoes after that time. Conservative treatments would typically involve supporting the foot and helping with pain and inflammation. So typically that would be padding, change in shoes, icing or anti-inflammatory medications. And nothing conservative really changes the bunion or fixes it, but it can help support and make people feel a little bit better. Surgery would be the option to actually correct the Tailors bunion.